Now, I want to introduce Scott Davis to everyone. Scott is our incoming chair of the American Heart Association Central Arkansas Board. And Scott, do you have some remarks for us this morning?
Well, thanks, thanks, Joyce, for this opportunity. You know, obviously, I have a passion for the Heart Association, having had family members and me personally having heart issues and dealing with those things. And so I appreciate the opportunity for us to give back to the community and having these types of community talks. And of course, thanks to LaShannon Spencer for leading these efforts. She's an outstanding speaker. I'm looking forward to hearing more about this. So, you know, the mission, you know, with the Heart Association is to be a relentless force for change and basically empowering people to make good decisions. I also know that one of the biggest challenges that we have in Arkansas is quite frankly the health disparities that we have around the state. Something, as being the CEO at Arkansas Urology, we certainly deal with on the urological side, and being involved in the Heart Association gives me a better perspective on that as well. So I want to welcome all of the guests here online, and thanks LaShannon for leading us in this discussion. So thanks again for everyone being here.
Thank you, Scott. And Joyce, if you don't mind, I'll just go ahead and get started.
Sure.
And just being mindful that we are grateful to St. Vincent, CHI, and to Celine Memorial for being the sponsors of community conversations. And so this whole week, we've been offering different subject matter and different speakers, and it's just been a wealth of information. And today I just wanted to give an overview of community health centers and then just provide a little stat about, you know, the cardiovascular that we actually see within our patient population as well. So when most people, you know, think about community health centers, they really don't know the history of community health centers, but the founding father of community health centers was Dr. Jack Geiger. And he understands that community health centers have become the bedrock of the healthcare safety net for this country. And, you know, just the growth of community health centers was something that he never particularly dreamed of. Health centers have become part of the nation's premier healthcare foundation, and it's a mission to communities to provide quality care that's affordable and accessible to all community residents, regardless of their ability to pay. And community health centers are actually governed by a community board, and that's based on the volunteers from the community that are passionate about improving the health and wealth of their community. Community health centers are often known as federally qualified health centers. In order to be a federally qualified health center, you must offer services to all, regardless of their ability to pay, establish a sliding scale fee, be a nonprofit or a public organization. You must be community-based with the majority of its governing board of directors composed of patients, and you must serve or be housed or located in a medically underserved area or population and provide comprehensive primary care services and have an ongoing quality assurance program. It was started, and community health centers was actually started in 1965 during President Johnson's leadership, and it was a part of his administration, the Office of Economic Opportunities. With the roots both in civil rights movement and war on poverty, the earliest health centers had its mission no less than using the healthcare system in order to bring about change. And Scott mentioned health disparities and how his entity is really big on improving the health of their individuals that they actually serve as well. In the early days, health centers have flourished. Currently, across the United States, there are more than 30 million medically underserved patients throughout the 50 states, the District of Columbia, and the U.S. territories as well. And as of 2019, there were a little over 14,000 community health centers, FQHCs, in the United States. Community health centers primarily serve patients who are historically the poorest and sickest in respective communities. Community health centers provide a critical service to the state in serving the low income. And so often we serve the most sicker patients. We're typically located in areas that are medically underserved. And community health centers have been an asset. And pre-ACA, most people that we actually see as patient would use the emergency room as their primary source of care, but they realize the importance of actually having access to a primary care. So pre-ACA, most people didn't realize the value of community health centers, FQHCs, across the United States. But the ACA afforded more access, and community health centers were actually giving more funding during that time as well. Within community health center, services includes family and community outreach, transportation, health, nutrition services, parenting classes, as well as social behavior and local services to the population that's served. The first greatest impact for community health centers is to provide primary care services. The second impact is really to decrease health disparities. And as I stated, just the ACA afforded, performance and value-based standards for reimbursement. Community health centers must have quality care performance improvement program that's actually embedded within their care. Community health centers have learned over time how important it is to improve patient outcomes, and that's where it talks about social determinants of health. And social determinants of health refers to the condition in which people are born, grow, live, work, and age. So everything that we do, we're focused on social determinants of health and focused on improving the health of the whole person rather than their acute symptoms. The goal is really to provide the best possible care as possible. Community health centers offer a multitude of services, including primary preventive care, oral health, vision, mental health, substance abuse treatment, transportation, translation, and enrollment services support. And that services are offered on the sliding scale differently based on patient family size and income according to the federal poverty level. We also provide case management services as well. There are 12 community health centers here in the state of Arkansas, and I want this time to be able to share patient stories with you, as well as an elected official story about the benefit of community health center within our state.
I was working with the learning rate class of finals, and I get stabilizing that I got there at the clinic and stabilized.
If it wasn't for the health center, teaching me, that and friendliness of and they're very kind. You don't feel like you're just shown out. You're treated very nicely. I like that. It's
Hey, LaShannon, we're having some hard time hearing, seeing the videos, and you're breaking up quite a bit.
Bit from it.
I'll go ahead and stop the video since people cannot hear those videos, but this presentation will actually be online and made available to you. So that way you'll have the opportunity to actually not only just see the patient stories, but actually our elected officials stories as well. Is that better? Can everyone hear me? Is it better?
Yeah, much better.
Sorry about that.
Yes, very clear now.
Okay. Again, you'll have the access to be able to see those videos at your leisure. And so more than anything, you know, people may ask, well, why does Community Health Centers of Arkansas actually exist and what do they do? As a not-for-profit organization, we here at Community Health Centers, we really focus on improving the health outcome for all of the health center patients. We exist to support health centers in data, evidence-based initiatives to benefit every patient who is actually cared within a health center. We recognize that many partners have important roles in actually improving the health of a community, including community-based organizations, patients, healthcare organizations, as well as our elected officials. And that's why a partnership with the Heart Association is so very important to Community Health Centers of Arkansas. It is our goal to provide better tools and resources and to help lead and transform healthcare in the state of Arkansas. We want all of our health centers to be recognized as healthcare leaders in the state, and organizations to really understand and respond to the complexity of healthcare through the best practices and innovative programs. And here you have staff members that are actually a part of community health centers as well. Here you actually have a map. Within this map, you will see the 12 health centers, and we actually have over 130 sites across the state of Arkansas. In 2019, community health centers across the state served over 230 people, impacting 230,000 lives. Community health centers are vital connections to quality and performance improvement and preventive health care for our medically underserved communities. And it goes back to making sure that social determinants of health is actually embedded within the health outcomes that are tackled each and every day. Community health centers actually receive 330 federal funding, which helps provide a foundation of financial support for their patients. It's very important for folks to understand that with the 330 funding, every health center must meet 19 requirements by the federal government, and that's a part of quality outcomes and quality measures as well. And as we talk about quality outcomes and quality measures, heart, stroke, and cardiovascular disease is so important to us. And again, that's why it's so important for us to have different partnerships with community-based organizations such as the Heart Association. Every 40 seconds, an adult actually dies from a heart attack, stroke, or adverse outcomes of cardiovascular disease. These deaths account for about 1/3 of all deaths in the United States. About 1 in 5 of these deaths are of persons younger than 65. Heart disease and stroke can also lead to serious illnesses, disabilities, and lower quality of life. The economic toll is very high, more than $316 billion each year in the United States, as it pertains to CVD treatment, accounting for $1 of every $7 spent on healthcare in this country. With cardiovascular deaths have been declining for the past 40 years, the reduction in these deaths has actually slowed since 2011, indicating the need for focused, sustained action by public and private partners to actually improve cardiovascular health. Every year, more than 1.5 million people in the United States actually suffer from a heart attack or a stroke. And these numbers are definitely alarming. And as we think about COVID-19 and the stress that COVID has brought on, it's really alarming, and it's causing us to put more attention in how we can actually improve cardiovascular health. And more so, the age is much younger. And so how do we really help teach younger people the importance of exercise and proper diet and taking care of their health? This is a slide from the Heart Association. And as I think about this slide, heart disease is the #1 killer in women. Across our health centers, 70% of our patient population is women. And so we make a conscious effort to educate women as well as men about cardiovascular disease. And so just heart disease is more deadly than all forms of cancers actually combined. When you think about social determinants of health and heart disease, and I put this slide because I want to show you some data from some data that I was actually able to pull from some of our health centers based on our community, and just how living in high neighborhoods characterized by poverty may act as a chronic stressor that results in different illnesses and just your immune system. And according to research, Blacks have a higher prevalence of hypertension and uncontrolled blood pressure than compared to any other illness. And what we try to do when it comes to our patients is really empower our patients to increase their knowledge. Within Community Health Centers of Arkansas, through our Health Center Controlled Network, and many of the staff members through the Heart Association has actually worked with CHCA staff in order to really examine and identify factors that increase a person's risk of heart disease in general, and the heart attack in particular. And within those lenses, we focus on risk factors, which actually includes the social determinants of health. And risk factors actually fall into 3 categories that staff members here often think about. Arkansas Controlled Network, we actually assist health centers with quality improvement initiatives, actually align with national quality strategies that supports the effort of health centers movement for better care for patients, healthy communities, and lower healthcare costs. And this is a slide that is important. We actually contract with Arkansas Center for Health Improvement, and we actually look at the data pertaining to core measures. And I wanted to pull this particular data out pertaining to cardiovascular events. And so 72.83% of our patient population is prescribed a statin therapy. Statin therapy is a lower drug that helps level cholesterol in the blood by reducing the reduction of cholesterol by the liver. And so this is a pretty high number. And so, we, doctors, clinicians within our health centers recommend taking statins if a patient has been diagnosed with a form of CVD, or if they have personal or family medical history that are likely to develop CVD over some period of time or within the next 10 years of their life. And I started looking at just the prescription or use of aspirins and antiplatelets, and just the blood cells, and how many of our patients actually take an aspirin or aspirin therapy. And it's 80.67% of our patients. And again, these slides will be available and uploaded on our website. Wanted to just really pause because I talked about social determinants of health and African Americans really being the most affected within when we started really looking in and digging into the data. Hypertension among health center patients. And right here, you will see Lee County Cooperative Clinic, which is actually located in the Marianna, Arkansas. And that is pretty high. It's 57.7% of the patient population has hypertension issues. And some of those common factors for hypertension can lead to high blood pressure, which it's a diet in high salt, fat, or cholesterol. And it has a lot to do with healthy eating or just not having access to healthy food choices or healthy foods within their community. And so, as you look at Lee County, that's over in the Delta. When you look at East Arkansas, that's over in West Memphis. When you look at the Cape and Rural, that's over in our Hampton, South Arkansas. But then you'll go to 23.3%, which is the St. Francis House, which is located in the Northwest Arkansas, where hypertension is only 23.3. That's pretty huge. That's seeing a difference in that we definitely have opportunity for growth when it comes to addressing hypertension among our patient population. And just that slide that I just showed you, actually, when you start thinking about, well, why do healthcare community health centers really exist? We know the high cost of healthcare is growing, affecting not only individuals, but it's actually affecting our state budget. In an integrated model of comprehensive care, health centers have proven year after year that they provide high quality care at a lower price. Significant reductions are actually achieved by improving the total process of medical care. And from a population health strategy perspective and case management, we really target interventions, and we look at core measurements in order to really drive outcomes that will help our patients improve their life. Community health centers of Arkansas, we're actually committed to helping health centers drive better care and better outcomes at a lower cost. We owe it to all the residents. We owe it to our taxpayers. We owe it to our neighbors at being good stewards of our dollars. And we take great pride in working and putting investment with key stakeholders to drive change at a state and national level that will actually benefit all of our patients. And especially during COVID, we recognize partnership is essential. Over the last year, CHCA has worked in partnership with the Heart Association regarding programming as it relates to managing blood pressure, healthier and active lifestyles, and the importance of stop smoking. And not only just that, just community health centers, but the Heart Association is actually making a tremendous impact during COVID-19 pandemic. The Heart Association is working with researchers and medical experts and hospitals, community leaders, businesses, and families to reduce the impact of COVID-19. And here on the screen, you'll just have the opportunity to see some ways that the Heart Association is dedicating more resources to make a difference. They're investing in research and helping to alleviate, drugs to combat COVID-19. They're leveraging science and relationship to help lead the conversation about COVID-19 and how it actually affects at-risk patients. They're working with teaching hospitals and communities on how to be safe and effectively administer CPR during COVID, during the pandemic. Also, they're working to advocate for policies that ensure families nationwide actually have access to care. Frontline healthcare workers have the ability to care for people with medical needs, and charitable organizations can continue to change their life-changing work. They're working to ensure the greatest need of the community are prioritized by including access to care, financial support, proper nourishment, and physical activity. They're working with patients and teachers to keep kids healthy and active while away from school, and providing businesses with essential resources to help their employees stay healthy and alive as well. And there's a call to action. COVID-19 has really impacted a lot of the funding and other resources. And the call to action is we must all be willing to partner together to really impact the lives of not only just Arkansans, but the lives of individuals across the United States. Any questions?
I have a question, LaShannon. This is Becky. And you may have touched on this and I may have missed it, but with the prevalence of the knowledge of health disparities that we're recognizing today, are the number of community health centers increasing to help accommodate that need?
Yes, Becky, great question. I keep seeing people saying it's something wrong with my speaker, and I apologize about the technical, my speaker difficulties today. For some reason, this is the only day that this has happened. But yes, we are seeing an increased number of patients dealing with other multiple issues, especially social determinants, because when you start thinking about rural communities where community health centers are actually located, individuals are losing their jobs. And so when you lose their jobs, there's a lack of access to health insurance. And so we provide care on a sliding scale fee. Does that answer your question, Becky?
Yeah, yes, it does. But also, is there growth in the number of clinics?
We are growing where we're growing on a yearly basis. And so, yes. And when you actually saw one of the slides, there is a growth opportunity in the Southwest area. And so we are definitely growing statewide. And not only do we just have physical, but some of our health centers are actually located within schools as well. So we have school-based health clinics also.
And LaShannon, when you say that the clinics are located in medically underserved areas in our state, I mean, do we have very many areas in the state that are not underserved?
Joyce, we have very few areas that are not medically underserved, especially, you know, we have huge urban areas, but Arkansas is a rural state. And so oftentimes when we have medically underserved areas, that's pertaining to the workforce and solo providers actually being there. And so through HRSA, we're able to offer special loan repayment programs for physicians, board certified physicians to actually practice within the community health center or underserved, medically underserved areas.
And can anyone just walk in the door to, how do they get involved?
You actually, for more information on the different locations of community health centers, you can actually go to our website. That is www.chca-ar.org, chca-ar.org, and you can find the closest health center near you and just schedule an appointment.
And do most people that use community health centers, I mean, are they non-insured?
We have a combination and it varies geographically. In our Northeast Arkansas, we have more commercial payer patients just because of the great care, especially within our latest edition of our quarterly magazine. We talk about First Choice actually being recognized as a top health center for women's health. In Northwest Arkansas, we have Community Clinic where we serve a huge Marshallese Hispanic Latino population, and they are employed within the poultry industry. And so some do have health insurance, some do not. In the Southwest area, part of the state where there's timber is a huge industry, you have insurance, commercial insurance. So it just varies based on the geographical location. In our Delta area, we have a huge uninsured Medicaid as well as Medicare population as well. So geographically, you know, Arkansas is a very unique state. And so it just varies based on demographics and geographical location.
Here's a question from our chat box. Where is our local CHC?
That is a great question. So we have 3 different health centers here in Little Rock, and actually Community Health Center, we purchased the old Franklin Elementary School that we're transforming into a community health complex. It is 70,000 square feet. And so when you talk about true integrated care, we will be converting a school to be able to provide an array of services. So we have our care that's here in Pulaski County, we have Jefferson Cump, and we have Healthy Connections. And we'll have a fourth health center within the Franklin Health Complex as well.
And another question, was the local mental health center, which was closed, allied with Community Health Centers of Arkansas?
No, there's no affiliation. So two separate entities, and our health centers do have behavioral health therapists or psychiatry services, and we do offer mental and behavioral health services as well. So when you're thinking about whole person care, you can get from dental care, mental behavior, primary, your preventive services, all in one shop.
And are you doing anything with telehealth yet?
All of our health centers are actually offering telehealth. We started offering telehealth services right when COVID-19 started hitting multiple communities. And so, you know, we have great staff, great clinicians, great case managers that actually called to remind patients that services, you know, are still being rendered and your health is still important regardless of COVID. And so we have telehealth services to be able to make sure that your needs are being met.
Are you coming up against any barriers around the internet or lack of internet service?
We do. Of course, you know, Arkansas being rural, and so there have been some challenges, but we've worked with a lot of our, you know, different companies, whether it's Windstream, AT&T, Comcast, FirstNet, to make sure we have access to broadband.
Do we have more questions for LaShannon?
We're pretty excited about the Franklin Community Health Complex and just the services and the benefit for Central Arkansas.
I am too. I keep hearing about it, but I'd love to come see it.
You're more than welcome.
Hey, LaShannon, this is Scott. In terms of, I mean, obviously in the rural areas, there's not as great a degree of specialized care. What transportation services are available to a lot of our Arkansans in these rural areas?
So, Scott, very good question. A lot of our health centers actually have their own van that can transport patients here to Little Rock. And one in particular, well, actually two, several that I can think of, but one that's here twice a week, Lee County Cooperative Clinic. They have a huge cancer patient population, so they're constantly bringing some of their patients to UAMS for different treatment. East Arkansas have a van service as well, but you know, they're closer over to the Memphis area. And so there's that partnership with some hospitals over in Memphis or St. Bernard that's located in Jonesboro.
Okay, good.
So we're always open for a partnership with you as well, Scott, if that's something that you would like to consider in the future.
Well, we are definitely, you know, with our foundation, certainly looking at ways that we can support that. I mean, obviously, prostate cancer is very prevalent, especially in the African American community, and a lot, quite frankly, due to health disparities. And so that really bleeds over not just into the urological issues, but most certainly in the cardiovascular issues. And so I think, you know, the way that we are going to have to address these issues is through collaborations, working through UMS. And that's certainly something that I definitely support is, you know, the health systems around the state working collaboratively to, you know, to improve the overall health of Arkansans. And what we do at the Heart Association certainly lends itself to that, the educational piece and the awareness piece. But, you know, and quite frankly, a lot of the research that's done and the money that we raise to support that definitely helps that as well. So you and I should probably talk offline, because we are definitely interested in supporting the rural health communities and certainly the community health centers as well.
Thank you. And also, I just, want to thank the Heart Association staff, Scott, because there's a lot of public documents or collaterals that we partners, staff members shared, and to help from a health literacy, health education, health coaching information that's being disseminated to our health centers. But I will definitely follow up with you, because Representative Ken Ferguson always challenges me when it comes to prostate cancer. What are health centers doing to increase, for better outcomes and to ensure people are pre-screening and not waiting to the last minute?
Yeah, and we definitely have that, and we have been struggling, and how do we get that out there? This year we offered free screenings in El Dorado and in Pine Bluff, which we haven't done in the 16 years that we've offered that during Prostate Cancer Awareness Month. So there's definitely opportunities for us to expand that. And I think the use of telehealth, especially in partnering with the primary care doctors in the rural areas and getting to specialists, not just urologists, but a lot of specialists that have that capability. UAMS is very much in the front of that. I've actually chatted today with Dr. Cam Patterson about some opportunities. I know he is a member of our board, and certainly being at the head of UAMS, he has the same mission as a lot of us in healthcare, which is to improve the overall health of our Kansas. We don't like being number 48, 49, or 50 on those negative kind of statistics around the country. And we can do better, and we should do better. And guess what? We will do better. And I think we will continue to do that. And thanks to your comment about the staff at the Heart Association, I will tell you, they work tirelessly. I've been in nonprofit before, and sometimes, it's you work really hard. You don't necessarily always see the results, but I do know they work very hard, and I appreciate them too. They nudge me, as busy as I am in taking care of all the patients that we serve through our 14 clinics. They nudge me and remind me to make that call, or yeah, Becky, I see you. You had to get on to smile at me, but they are a wonderful staff. They do a really great job, and definitely they all live the mission of the Heart Association.
That is correct. And just, as you're talking about, and it goes back to COVID has impacted not only just the health, but just the economics. And so we have to be more intentional about our partnership based on just shared resources, just to really impact, all our Kansans. And so I look forward to multiple entities, specialists actually working together for the good of our state.
Yeah, absolutely. One of the really neat programs, and Becky may want to talk a little bit about it, but we have a campaign called Don't Die of Doubt. And because of COVID, so many people are out there worried to go to the doctor, worried to go to the ER. And it is a little scary right now. We are definitely seeing a surging trend in positive cases and hospitalizations. And that was one of the things that Dr. Patterson and I talked a little bit about. UAMS runs some models, and you look at these models and they're a little scary. And you're sitting at home and you've got a little bit of a chest pain, or you've got, your heart rate's, skipping a beat, and you're just afraid to go to the ER. You're afraid to go to the doctor. And we've got to educate our Kansans that don't die because you're scared of COVID, because it really is. The hospitals are very safe. Our clinics are very safe. We've got all the precautions in place. So I just love the title, Don't Die of Doubt. And so, Becky, you want to make any comments around that? I know we've got some people on the line that may not be aware of the program.
Right, and I think we touched on it earlier in the week, but certainly there are different people on today. And we're launching that campaign in 43 Big Red stores across. We're launching the message on collateral in 43 Big Red stores across Central Arkansas, letting their customers know that if you're experiencing symptoms of a cardiovascular event, that the safest place to be is in a hospital. We had Michael Stewart from Celine Memorial share with us a personal story of gentleman that was at the hospital in the ER, and he talked to Michael Stewart and said, I wasn't afraid to come to the ER, I was afraid of being in the waiting room. So yes, people are afraid of being exposed to COVID in the hospital setting, and they, you know, the hospital is the safest place for you to be if you're experiencing symptoms. So
Absolutely.
And don't die of death. Just the whole, so where the big reds are. And so we're making sure that we put information up together. Again, it's just that whole shared partnership in order to really bring about a sense of awareness that it's important for people to go and have a primary care physician and not necessarily just seek care within an emergency room setting. Because when you do that and you're uninsured or underinsured, it really impacts our state. And so just having that relationship with the PCP or a community health center is so critical. Just so when you are sick, that physician can then have conversation, or your information is already in an electronic health record, that a system is a part of the share. And so people can actually be able to see you and track your health. And that's all I have, Joyce, if there are no other comments.
Okay. Well, then.
Well, Liz did post a question here just recently. Do most of the federally qualified health centers participate in Target BP?
Oh.
Yes, we do. And Sherry Luster oversees the targeted BP program. So yes, and they also have health coaches that actually help follow individuals that are part of the program. Yes.
Okay, great.
Very good. Okay, well, I will close this out with a little more information. I want to start by thanking you, LaShannon. Thank you so much. This is great information. What a difference Community Health Centers of Arkansas makes in quality, accessibility, and affordable care in the state of Arkansas. So thank you for that. And thank you for working with American Heart Association to be a relentless force for a world of longer, healthier lives. You know, why is this needed? Why are these webinars that we are doing this week, and the Don't Die of Doubt as well campaign that we're working on? Why is that needed in the state of Arkansas? It's because heart disease is #1 killer of Americans, and stroke is #5, and it will affect us all. 1 in 3 of us will lose our life to heart disease or stroke. It's bad news. It's daunting, but you know, the state of health in Arkansas is not good. We are unhealthy. We live poor lifestyles and practice poor lifestyle habits. We're at the top nationwide at stroke. Our high school students rank #1 in the most overweight or most obese in the nation. And we know that when you are overweight as a young person, you are more at risk of being overweight as an adult as well. 68% of Arkansans are overweight or obese. 24% of Arkansans smoke. LaShannon talked about how many of Arkansans have high blood pressure. Those that know about it even. We've got a lot to overcome. And so that's why we're doing these senior health webinars this week. That's why we will kick off Don't Die of Doubt next month. These are sponsored by Community Health Centers of Arkansas, CHI St. Vincent, Celine Memorial Hospital, and National Park Medical Center, along with the Big Red stores. And these are around the state. We're working hard to get that message out. American Heart Association does a lot of work around this risk to all of us, but there is good news too. Heart and stroke incidents are both very highly preventable. We just They're treatable and they're beatable. And we can reduce heart disease and stroke by promoting healthy diet and lifestyles, helping educate and lowering those risks. And they could start with very small steps. And thank you everyone for being with us today and educating yourself. Thank you to our sponsors. We will continue these community conversations tomorrow at noon. We will also be posting the recordings on social media. So please go to our Facebook page and like and join our Facebook page at American Heart Association Central Arkansas. And I will end again with 6 words of challenge: eat better, move more, don't smoke, for better health. Thank you everyone so much for joining us. We really appreciate it. Please put to good use what you're learning this week at our senior health seminars. Thanks all. Thanks for being with us. Bye-bye.
Thanks, Joyce.
Thank you.